COVID-19 has made the life and death disparities in health research and health care even more visible. And the images and the numbers are unavoidable and frankly undeniable. But let's be honest, we as a health research community have been aware of health disparities for a long time. We have been talking about addressing health disparities for a long time. And our discussion today is going to explore what actions we can execute immediately to mitigate the disparities of the impact of COVID-19, and very importantly, how do we translate this undeniable visibility of this issue? How do we translate that undeniable visibility of this issue into concrete progress against the entrenched inequities in health research and health care?
With my background and focus on research, I'm thinking, how in the world can we do something about eliminating this pandemic if we don't even know for sure who is affected, and looking at it in terms of different populations that are affected? And that becomes even more important when we think about where we are now.
There are a number of factors here. I'd say some of the ones I would say immediately that we should use would be working with leaders in the community. Because one of the problems in our health system is lack of information and lack of trust.
We need, public health likes to say today that your zip code is a stronger predictor of how long and how well you will live than your genetic code. Emphasizing the point that the opportunities to be healthy in the places where people spend most of their time are the big drivers. These social determinants are huge drivers of health. And I think one of the things we need in the United States is a Marshall Plan for disadvantaged communities that would create opportunities at a neighborhood level, and access to schools and access to good jobs and access to high quality housing and living conditions. That is a priority in terms of really making sustained progress.
So the status quo in terms of healthcare delivery, public health services doesn't work effectively for many populations. So digging into why is that and how can we disrupt that and create new models of care that are effective, new models of public health information, new models of getting mitigation to communities so that they are actually effective and at the end of the day achieve the kind of health outcomes and get to that North Star that we all hope for, which is optimal health for everyone and leaving no one behind and leaving no one out.
We are encouraging diversity in these clinical trials because it's so important to understand the impact on our communities.